they will present to us, and then after that we'll have a chance for some questions and answers. And yeah, I'm very much looking forward to this. So, Bharat, over to you.
Thanks, Tom. Thanks, Christian, and the team for your support, especially during this voluntary time. That I'm especially thankful to Christine, and she quickly took an action to make it publicly broadcasted in this. So yeah, we are going to show how the communities successfully own the CRC in Adwa, Tigray, Ethiopia, which was transitioned by one agency to another agency back in July. It was handed over at the end of June. Then the local organization, took over the resource center and 6 IDP sites, and all of them are being managed by the government authorities. And then government authorities are using the clusters template, and they are sending the service monitoring data. They are sending the site profile data, and cluster is publishing the site profiles managed by the government authorities. So the sites as well as the CRC now have been handed over to the communities and the government authorities. More of CRC is owned by the communities, and the sites are being managed by the authorities, but in coordination with the communities. So without any delay, we would like to go through the presentation. In the meantime, we will have a conversation. And while Irga is also here, he will also tell us about how the communities are using the site maintenance toolkit for their livelihood also. I hope we will have enough time to do that. So welcome everyone. My name is Bharat Adhikari. I used to work until March 31st as a CCCM cluster coordinator in Ethiopia. And this was the time that the CRC was handed over, and we thought that it would be good to present in this public forum, and it could be replicated where it is applicable. So let's go to the next slide. Yeah, this is, you can see, we put the name as the community resource centers, just not as a humanitarian space, but it can be a community-owned sustainable asset if we are able to successfully engage the communities. You can see in the picture, there is government authority and the camp management team in the front. It was surrounded by the CCCM other team and the communities. They are doing the dialogue. And in the first picture that was shown was myself attending with the government authorities and the community consultation what they would actually need to sustain their facilities without the humanitarian agency. Next one, please. Yeah, so you can see in the picture at the right, when the organization didn't have the funding and it was just like monthly kind of monitoring thing. We used to see the problems and we used to report, but there was no one to take an action. You can see the garbage and field wasted everywhere. People used to have the space for chewing the chat behind the CRCs, and there were no public facilities properly organized. So these were the things that we had during the handover. But that was the challenge. If we do not have the proper community engagement, then CRCs become the risk as inactive or humanitarian space, or it cannot be used for the purpose that it was supposed to be. And coordination for that, coordination spaces require ownership and governance. That was not there. That was the challenge that we faced while it was transitioned from one agency to another. And then infrastructure alone doesn't ensure the sustainability. That was the thing that we realized, because the building is massive. It was even hard for the communities to manage the building at first, like what to do within that building and how to use that. And then early transition planning, when the organization Positive Action for Development took over, then since the beginning of that, we engaged in such a way that it should be handed over by the end of the project. That was the aim that we organized, and with the organization, implementing organization, which is PAD, and then the communities along with the government authorities. So otherwise, it could be very challenging to go through the transition and handover just drops somewhere along with the agency exiting, and it falls into the same situation before even the response is started. So that was the thing that we realized in the beginning. And then while transitioning from one to another, we made sure that communities are engaged, government authorities also take the initiation and take the ownership. And necessarily, they support the communities, they engage the stakeholders, and they make everyone accountable. Yeah, those were the things that we faced the challenge in during the transition. Next, please. So what we learned along the way, when we had the first consultation with the communities, they mentioned that such type of community related, like community owned dialogues have not been initiated. That was the thing that they mentioned, and what they really want and what actually the organizations or the implementing agencies, service providers, the government authorities think about the communities. There was a very big gap. So what they told us, to the CCCM cluster team and camp management team, was that they need the capacity building. That was the first thing. And then second thing, they should be the problem identifiers, not the others, like the government authorities or the service providers should not be the one to have identified the problems. And then acceptance was not immense. Like even what they were mentioning is when we had the discussion with them, they were saying every organization or every person comes and asks a lot of problem, what is going on, what happened to you. Like they try to listen to us, but in the end, nothing happens. Everyone comes with the first like expectation or the assurance, but later on what they do is nobody comes back after taking our problem. So there was like fatigue, and not immediate acceptance, not immediate trust from the communities that we realized. And government takeover progress step by step, that was also one of the realization. As I showed in the first slide, that was the first consultation. Then what we came to realize that the communities were mentioning they were not involved. So we also changed the mechanism in capacity building. That was the first time I engaged the community leaders in the capacity building, how the CCCM overall works, and what should be the shift that we need to work in terms of engaging the communities and sustaining the ownership through the community. So in that forum, you can see in the first picture, that was the capacity building done to the government authorities and communities about the information management capacity building by our IM team. And the second one was I was one of the facilitators, and we 2-3 facilitators organized the training for the communities, for the government authorities and service providers, along with the cluster coordinators at subnational level together. So everyone was in the forum, and this is where the communities mentioned that there is a relationship between the communities and the humanitarian agency, only one. What they mentioned was, you are the donor and we are the recipient, which doesn't work because you give us what you like to give us, but that don't fit with our needs. Therefore, we try to adjust with those things. And one of the community leaders was asking us actually, like, you have seen your items sold in the market the next day because you give us what you want to give us that don't fit with our needs. Therefore, we have to fit with our needs. And even if we don't accept those needs, accept those items that were provided, then there is a risk of deprivation that we will not even get those resources. Therefore, we get it and then sell in the market to have our own needs fulfilled by exchanging or by selling at low price, whatever. Therefore, the relation should be changed from donor to recipient to the interacting like we should be partners doing the partnership together. The partnerships with the community should be together. That was what they were mentioning. And then government's capacity building was also very limited because they were not able to take many of the activities that we were proposing in the beginning, but later on, step by step, for example, organization PAD gave them some of the gadgets or devices, how to collect the data, where they installed the Kobo toolbox, where they knew how to utilize those devices and send the data. And CCCM Cluster also provided some of the laptops and then printing machines to the government authorities. This is how the capacity, not only we did the workshop and sensitize the knowledge, but also we equipped them to some extent. And then the other thing that we came to understand is that our handover process is quite quick, as I also mentioned in a previous slide. When time comes, we inform everyone that we are going to exit from this month, and there is no like proper preparation in many locations. So if we do step by step and if we do from the very beginning, that is the thing that can work for sustainable ownership by the communities and the authorities. So those were the things that we understood. And then then the other thing is what we understood is there is a very big gap between the durable solution initiatives and the humanitarian response. Because there is a tendency, particularly in Ethiopia, that durable solution starts when fully return or relocation takes place. So it should not be the case that humanitarian and development actors should be working in the same space where the CCCM can be enabled to do the transitioning of the the humanitarian response to the recovery. Next slide. Yeah, so what was done differently in Adwa? Mamune will step in from the next slide. Just want to mention here that local authorities led coordination was done differently because from the very beginning, we enabled the government authorities that they should be chairing the meetings at site level, at CRC level, at any type of like partners level, and in as a backup, the CCCM cluster team and the camp management agency team continuously build up the capacity how to lead the coordination. And inclusive community governance established thanks to CCT. There is a tool that we used how to assess the community's capacity and how to include the host communities also in the governance leadership structure. Then CRC design for daily community use, like how we design the community uses. So mainly there are from I think it was from August, the agency took over at the end of June and it started intervening from July. From August onwards, on daily basis, 150 to 200 individuals when the infrastructures were installed, the flow of the communities came higher and higher, turned to be higher and higher to the CRC for visiting, and the main purpose of visiting is the access to information. When the Wi-Fi was there, they came for recreational activities, for learning, for expectation of the services also, and they also came for safe complaint and report mechanism that it worked. Next slide, please, where Mamoni will tell more about the picture, how it went through, because he was following more closely at field level. Mamoni, over to you.
Thank you, Bharat. Good afternoon, everyone. Mamoni here. I work as a subnational cluster coordinator for the CCCM and SNFI with IOM in Ethiopia, in the northern part of the country, in Tigray. Linking with the previous slides, here the Community Resource Center, the CRC, has been serving through several service provision, including, as you can see, some recreational refreshment activities that are handled by community groups. There are also several halls that are used for the coordination forums whenever there is the coordination, which is usually led by the Social Affairs Office of the government and sometimes supported by the town administration. So in this CRC, there is usually a monthly coordination meeting that has been being facilitated by the camp management agency and led by the Social Affairs Office to discuss on several matters, including any service gaps, any service providers update, as well as the community needs and how the community groups that have been established by the camp management agencies are working on the support they have been provided by the agencies. So this in this coordination, in this CRC as a coordination, the government facilitates the coordination with the service providers as well as the community leaders, and also the community groups that work in this community research center to generate some income through some activities in the resource center. So there are some service types here. There is a meeting hall, there is coffee, there is DSTV. There are also some youth recreational activities such as tennis. And in terms of reporting, there is one designate from this community group in the CRC that usually updates the Social Affairs Office on any challenges or any progress that have been made in terms of like establishing clear guiding criteria as well as managing the daily activities by the community groups. To the next slide. Yeah, so this in the resource center, as you can see, there are some recreational activities basically managed by several groups. We have several groups that are linked here by the camp management agency through several supporters. In the coffee shop, there is high users from outside, even from the community. It's also around the bus station of the town, and there are several visitors to use coffee in the area. There are also high visitors when it's weekends, especially if there is football match and some recreational activities. So the livelihood linked activities really supported in terms of sustaining the CRC. We have seen quite encouraging outcomes during the project closure around March. So the community groups that have been established and supported with some livelihood activities are generating income, and they are covering the recurrent costs such as electricity, Wi-Fi bills, water bill, and all those things. So the center, luckily, It has a library within the community resource center, so people will usually go and read there. There is the whole system, including the wash facilities, are linked with a sustainable water supply system of the town. So there are users for bathing as well as some recreational activities in the center too. So those income generating activities are really supported in terms of covering the running costs as well as sustaining the community resource center in a good shape. While providing the services, the community through the use group that are established have identified several vulnerabilities to safeguard and provide access to those who are unable to afford. For example, when there is an older person or a person with difficulties or with economic distress, they would allow them for free to watch the TV, even the DSTVs and all those. Other than those that are purchased by the community use groups, the rest of the services can be provided to those who really cannot afford to pay. And it really supports in terms of safeguarding and provide access to those who cannot afford. Next slide, please. Bharat, can you recover from here?
Yes, I can. And within that, Mamani, one thing that we must inform here is, people also pay money to money as the contribution for the CRC. Mamani, you were mentioning that they collected the amount 70,000 beer in a month, while their operational cost was 30,000. So they are in 40,000 surplus. And next phase is that the communities are going to buy the projector and renovate the community hall that could be used for fancy training for the humanitarian actors that they want to use for the training. And then that could be the best way to sustain for a long run. And in the meantime, I was sometimes back talking to Jen and Christine both, that the communities were using 15 beer for outside watching the match in the town, but they were paying 20 beer back in the community resource center. But the time changed very recently over the week because of the fuel. I think it was because of the Middle East crisis, also the fuel cost, and that went up high in the town, and they increased from 15 to 30 beer. And now the communities are still watching the football match and other recreational activities at 20 beer in the community resource center. So it has double benefit now, that even while the price was less in the town, the flow was more in the CRC. And obviously, along with the price increment in the town, there will be more flow and the communities would be matching there. So yeah, so what helped to make the transition stick? Like CCCM led forums build shared understanding. That was the first thing, as I mentioned before, during the community consultation, that the communities were mentioning, well, you guys are giving us whatever you would like to give us, but we don't fit with those items and we have to use it. So it was a shared understanding that we came through, and it was the community and the stakeholders, as well as the service provider, cluster coordinators, and the government authorities, all in the same forum. We were doing some of the simulation exercises, some of the capacity building of the CCCM. That this CCCM house, I always like to present as the introductory. You can see in the first slide, and the credit goes to Jen, who build our capacity every now and then since I joined CCCM, I would say. And so this is how, and in this forum, like the most important thing is people with disabilities and people with like 6 months babies. They also community leaders. They also came to join for along 4 days, full consultative workshop that they came, and they contributed. And what also happened is that the communities, what they mention is that they mention their problems, and not only that, they also mention the solutions, what could be. And there was a case back in 2022 that the IDPs who were trying to access the firewood in the jungle, at that time the jungle was in the reserved area, and they were detained up to 72 hours, some of them, and some of them were unfortunately encounter SGBV cases, and they were saying that we need to get rid of these problems. And then the CCCM cluster, along with the camp management agency, did wider consultation what the communities can do and what the camp management agency should be doing and what should be done by the CCCM cluster in terms of capacity building. So CCCM cluster advocated for funding. Then they gave the funding for site improvement. That site improvement activity was utilized for electrification and sustaining the water facilities for a long run. And the communities agreed to pay the electricity bill, because good thing is that in Ethiopia, electricity is not that very expensive. And those communities who are not able to pay, that are being supported by the other communities and community leaders through the cost recovery mechanism within themselves. And within that also, not particularly related to the one site or other, CCCM cluster also developed the vulnerability criteria, vulnerability target criteria, and it has been implemented in one way or other in different sites, how it is applicable. So partners focus on what communities couldn't manage alone. That means like the electrification was not possible from the community, so it was done by the partners. And government also mentioned, gave the authority to establish the install the electrification, because there was also a lot of discussion and challenge that if we develop the infrastructure, community wouldn't be going back to home and the displacement will be prolonging for a long period of time. That was also the discussion, but government luckily helped and electrification was possible. So that reduced GBV cases, that reduced the like reduction of firewood, that the people began to use the facilities in electrified cooking stove. So it also contributed to the climate protection and Wi-Fi connection. That is also one of the things that that made the community resource center so much vibing with the engagement and information learning mechanism, public awareness. People used to come like to share their own exchanges. There is also a library that people can come to learn the things, read the books. So the clear role for sharing strength and confidence in exit was also done, like what should be done by the communities, what should be continued by the government authorities, and what should be continued by the CCCM cluster even after the exit of the CCCM partner. So Mamuni, you might take over from now onwards. Hopefully you will be remaining for a longer period of time to do the some like post exit monitoring and see how it goes in the next 3 to 6 months. Next slide, please. Yeah. So yeah, these are all the dialogue, and you can see the second picture when the government authorities, they were so much happy and so much appreciating the CCCM cluster for building the capacity of the government authorities, which they never realized before how it would be happening. And therefore, as a appreciation, they gave us the appreciation later to the CCCM cluster. Mamuni is taking over that appreciation later, and they were happily taking over the activities. And in the third picture, it is camp management agency engaging the communities, how they should be informing each other, how they should be informing about the rumors, about the programs going to happen through the community resource centers, and how they could be engaged in a better way, that the protection network can also be enhanced among the communities, and they could be there could be like cohesive synergy between the host communities and IDPs, that the service provisions can also be equally shared along with the responsibility. Next one, please. Yeah, so these are some of the pictures. As you can see, those are Injera stove, and I am going from the right corner on the top. These are Injera stove. They are electrified one, and they were given to the communities, and the communities can make the Injera out of that without any fuel cost. And they sell in the communities, and they also access that one for personal cooking. Those who are cooking for commercial purpose, the small contribution goes to the CRC management. And you can see also this is also one of the we actually combined some of the pictures. This is also the lighting system in one of the sites in corridor where the people were having difficulties not only cooking but also walking during daytime. Also, you could see it was taken in midday. Without light, there was difficulty even to walk. So the electrification was done, and then top on the left, first and second picture, it also contains like some barber shop's chair, and it was given to the youths who would be installing the barber shop very close to the CRC, and the IDPs who go to access those barber shop would be given at lower price, and those who come from the town, and they would be charged the higher price or the equal price. But it was given by the camp management agency. So these are all. And then also the coffee shop, establishment of coffee shop was also done by the camp management agency, who gave the equipment and the coffee shop for the first round. And when the government authorities come to organize the meeting over there, they sell the water, they sell the coffee, though they don't pay the rent for the hall, but they pay for coffee and tea cost along with water. And that is running, or that is sustaining the cycle of tea, coffee, because in Ethiopia, without tea, coffee, the discussion rarely goes ahead. Next one. Yeah, so this one is some of the equipment where necessary. The first picture shows it including the construction, and then some of the stationary items given to the community leaders for managing different types of activities that are required to support the communities. Second one, you can see the library, someone is studying and others are also arranging the file. And the third one is how the communities are making the the registration of the money that they collect on daily basis. So it is very manual, it is very traditional, but more traditional is the trust that is working among the communities. Next one. Yeah, so these are the pictures only. You can see on the left side, the communities are the youths are playing. It has two implications. In one of the sites, when one of the CRCs, when the camp management agency could not really follow up because of the lack of the resources, some of the youths took over and they used for gamble. That was very bad story. But here, the communities are using for the entertainment, and they are playing rotation by rotation, not for any other use, but for entertainment only. The second one is the camp management team doing the women's participation activity along with the coffee. You can see a lady sharing the coffee. And third one is you can see the camp management agency providing the coffee, coffee cups, and the cooking or coffee boiler as the equipment for them to continue. That has brought the dignity and the participation as well as the ownership of among the communities. Next one, please. Yeah, it's also the continuity. You can see the first is the organized library now. The second one is the improved infrastructure where the communities who cannot access the water in the town, they also come for even taking shower, and they also pay. Some of the communities who don't find the privacy to take a shower, they also come and take shower. They contribute to the resource center. And some of the other communities who are vulnerable, they come and they use the services for free. On the left side, you can also see the latrine with the that is accessible latrine for the persons with disability. And the third one is, I think it was repetitive, but here we can see some of the construction tools also for the communities to continue the repair and maintenance thing, and that the camp management agency has provided. Next one, please. Yeah, so it is improved the structure again. Those are supporting the dignities and access. The communities come for using the services, communities come for using the access to information, communities come to the CRC as a visitor to safely reporting the things. So these are all enhanced structures that the communities are able to use and able to run themselves. Next one. And this is the final slide where the camp management team is doing the inventory of handover of these services to the communities, and they are counting. I was not there, and Mamuni is also remotely coordinating, but this was the handover process that they did. That's all how we went through. Thank you so much.
I really enjoyed that. Thank you very much. It's very, very interesting. And I have to say, there are times when I felt uncomfortable because a lot of the problems you raised at the beginning around trust, around community acceptance, around finding something that's real and meaningful and something that is therefore really sustainable, that's all stuff I've seen before. And sometimes I've seen it work well, but more often I think I've seen it not work quite so well. So it's really interesting to hear your perspectives there. And I'm wondering if anyone has any questions to ask. Yes, Abdurrahman, over to you.
Hi, everyone. Greetings. I hope you're well. My name is Abdurrahman. I'm reaching out from Afghanistan. I'm the CCCM project manager with ACTED, operating in Afghanistan's mission. We're basically operating the same CRCs. This was amazing to see such an initiative has been taken over with our colleagues in Ethiopia. I just had one quick question because we're also thinking of a transition phase of handovering the CRCs to the community. But of course, the context here is a bit challenging and complex because mainly we're targeting rental infrastructures. But as of now, we're thinking of how can we reinforce and change this into constructing a CRC for the community itself within the phase help and support, etc. But my question is mainly whether if the CRCs currently in Ethiopia are rental, if it's rental, are the communities going to support the sustainability of the CRC, and what other type of systems you have considered to ensure the sustainability of the CRCs without partners present into it? Thank you. Over.
Yeah, just to be precise on the answer, it is not rented. So it is government-owned building. It was built for the youth center, and it was abandoned, it was vandalized, it was not utilized. And it was the revitalization or the reutilization of the infrastructure. But of course, building alone doesn't work. Rental is one component, but there are many other components that are also linked with. So while leaving those structures to the communities, we should be an enabler to lessen the burden of the communities. And if you are thinking of the rental structure to be handed over, we would not recommend to do that, because I mean, the structure that the communities have taken, and they have their different sources of income. For example, I mentioned that the person who comes to take a cup of coffee contributes some money. The person who comes to take one session of the football match, he or she pays the money. This is how there are some sources that we have identified, and those resources are working. But that might not be the same in the context of Afghanistan. So we would really encourage that you should have the public structure, that the communities should not be having extra burden on it.
Thank you.
Yeah.
Thanks a
Kristen?
lot.
Christine.
Thanks very much, Bharat and Mamune. My question is also about funds, because you were mentioning the income, how the displaced they're paying a lower rate than the community members, the host community members, for several of the services that are provided in the center. And I'm just wondering, like, how did you get to that? How did you manage that to get the host community on board to pay to pay more than the displaced? It's an amazing feat, and it's a great kind of business model. But yeah, tell us how you did that.
Yeah, Mamani will also back me up on that. Just to say one thing, we engaged the host community members more than the IDPs, because in the IDPs locations, we were there through the partnership with the organizations who are working in the CCCM sector from the very beginning of onset of the emergency. But the host community members were really felt ignored, and they were not very much engaged. While we initiated for this transitioning period, that then we realized that the first if we did not talk with the host communities, that's not going to happen, and we are not able to materialize it very well. That was the first thing that we realized through the consultation. Also, we didn't ask how is the relationship with the host communities directly, but we assessed the scenario, how they are accessing the services, what are the common services they are accessing, and what is the position of the host communities in terms of accessing government facilities, for example, and how the IDPs are also accessing in this case. And when we brought the host communities on board after assessing their capacity and their willingness to support in this center, because the youth center was basically established for the host community members to engage the youth. And when we brought them on board, they felt that their property is getting back, and they are going to get their property back. It is not very like 100%. It might not work, to be very honest with you. Like, who is IDP who should be paying like 5 less than the host communities? But it is the trust that somebody comes with, says that I'm from host communities. Some of them say that I can pay, and others might not say that I cannot pay. There is no hard and fast rule that you should pay this one and you should not pay this one, but it is overall working and the trust that the communities are working. Mamani, over to you for that, if you have additional thing.
Thank you, Bharat. I think you have mentioned most of them. So the reduced fee basically is applicable in the center. Whoever goes to the community resource centers, services that are provided there are reduced comparing to the services that are being provided outside the community resource center in the town. And the reduced fee for the IDPs that have been mentioned in one of the slides is, so the camp management agency provided these tools for the barber shop, and these barber shops, some of them are installed inside the camps, and those that are being served inside the camp, they will be paying less than those that are stationed or installed outside around the town nearby the community resource center. So the comparison is where the service is installed is what determines the reduced fee. Over to you.
Cool. I have a question as well. At the beginning, you said that sustainability was really a question of governance. And I've seen places where handovers were not done very well, where for many reasons. But if as a humanitarian practitioner, if I wanted to do a really good sustainable handover, there's a huge number of things I need to do with community engagement, budget planning, stakeholder buy-in, managerial buy-in, many challenges and problems in the way. So the path of least resistance is to carry on with what's been done many times before, which is not necessarily the best way of doing it, as I think you're showing here. What would you, if you had to say one thing to a humanitarian organization or a project manager or somebody who is thinking about this handover process, trying to start it in the best way possible, but is really daunted of them, what would you say?
Sorry, last piece I missed, Tom. Your voice is broken.
Okay, if you had to say something to a humanitarian organization or a project manager who is about to start this process and is daunted by the huge number of challenges ahead, what would you say to them?
That's something that I always talk also. I would like to mention 1 minute scenario, I would say first, before answering your question. How it happens is camp management team, we deploy them in the site or in the CRC area. They go, they meet the government authorities and they meet the leaders. And then they ask the problems, but they really lack in terms of assessing the actual community's problems in the depth level. And community engagement is never sufficient. We cannot do everything because it differs from family to family. It differs from like demography to demography, context to context. We will never be able to engage the communities up to the 100%. But I would say that there is a lot of things that we can do through the community engagement. First, talk to them. And don't be Mr. Know-all, that you know everything, going to the site, somebody staying in the tent, having difficulty in cooking the food, accessing the food, accessing the school for their children, accessing the health clinic for their treatment, doesn't mean to say that they do not have other invisible problems that they would like to be heard. So the first thing is that we must talk to them. And the second thing is communities themselves cannot be the ultimate decision makers if we do not engage the authorities. So there is a very interlinked connection between the communities and authorities, because ultimately, even if we hand over to the CBO for a certain period of time, mentioning that the CBO is within the communities and they can work, ultimately, if we are failing to build the capacity of the government authorities and the communities who remain for long lasting, that wouldn't work, I would say. So the most important thing is please talk to the communities and engage the government authorities. For example, electrification of the site and reduction of the fuel or dependency on firewood, those could not be avoided if the government authorities were not taking initiation in supporting the communities and making the decision that if communities agrees to pay the bill, let's install the electricity in the sites and in the CRC. I hope it answers your question.
Thank you, Bharat. And Elena?
Hi everyone. I just wanted to complement what Bharat said and maybe stressing the accent that it's important that we really start thinking about the handover process and our exit from the very start. Exactly how we say that the moment we set up or start intervening in a camp, we need to think about camp closure. So I think it's exactly the same with community resource centers. And I think the last year clearly show us what happens when we don't have exit plan in place from the beginning, and that we start working on that exit plan from the beginning, right? So I think it's very, very important that the conversation that Bharat mentioned with community, with the authorities starts the moment you are funding your space, basically.
Absolutely. And the thing that I have also realized that many of us, I wouldn't say all, we try to learn, but many of us, as I mentioned, like I have faced such type of challenges when I go and we go in the multi-sectoral assessment, for example, and people looking at their stocks, they try to fill up the form before even they ask the question. So please don't do that. And communities, they have their own problems to be heard, and we should not be knowing their problems, saying that we have done our work for 10 years, 15 years in humanitarian sector. Every individual's problem counts more important than we know. Yeah. Feda Ali?
Thank you, Feda.
We have Feda hand raised.
Actually, I am blessed for this experience, this story, because I have two questions. One of them about the vulnerable group, women, person with disability, elderly people, and vulnerable groups. How did you ensure they include in managing this center when you plan to have? And also, I think this model could work in conflict setting with repeated displacement. Like, if how we can adapt something like this.
I'm not sure if I could hear all the problem. Sorry, what you said, Feda? Your voice was broken.
Yes. You cannot hear me?
Did you hear?
Feda, perhaps if you turn off your camera, I heard some of it, but not all of it.
I think the first question, I think I got it, was how were women and vulnerable groups, how were they involved in the handover? And the second question, I think, was around, could you use this model in a context with repeated displacement? Feda is based in Gaza, so I think that's relevant to her context.
Yeah, both of them are very good questions, actually. In terms of handover process, what we did, as I mentioned, during the capacity building, persons with disabilities, persons as lactating moms, and different women groups, we included them in the capacity building, and their voices were heard, what they actually need. For example, electrification of the sites and the CRC that came through the women's initiation. Not necessarily, because it's like my country in Nepal, many males, they don't bother about the household affairs, and in Ethiopia also it's more or less the same thing in terms of cooking, in terms of preparing the kitchen. the men are not very much bothered. So it was a women group who mentioned their problems, and we were able to address their problems. And in handover process also, there are people, women's group, and people with persons with disabilities, and then other vulnerable groups. They are equally part of it, and they were involved from the very beginning in terms of taking over the ownership. Because as Mamune mentioned, there is also certain trust that sets also criteria: who can pay, who cannot pay, who can be part of it, who need special support while accessing the services. Those were clearly communicated. So handover process was done that way. I hope this answers the question. And the next question is more crucial, and it is more important if it is applicable in the repeated displacement situation, which I would say might and might not both, because the first thing is the government's initiation is required, where government is knowingly or unknowingly part of the problem in terms of conflict. In that case, it is very hard to implement, I would say. And in other case, I want to borrow Irga's statement that when the communities are struggling for day-to-day survival, community participation becomes a luxury for them, because we cannot force them to participate and do extra job. So it is very contextual, but I think if the government initiates and tries to build the capacity of the communities and aligns with the community resilience, it is definitely practical, I would say.
Cool. Thank you very much. And Feda, I'm glad we got to that question. That was really interesting. We've come to the end of our allotted time now. If there are any more questions to pop in the chat, that would be great, but I haven't seen any. So I just want to say thank you very much to Bharat and Mamune and the whole team from the CCCM cluster in Ethiopia. I think that's really inspiring, really interesting. And I very, very much enjoyed listening to what you were saying. So thank you very much for your time. And also want to say thank you to the members of the advisory board for the Community Engagement Forum, every single one of whom is doing this in a voluntary capacity, especially Chris. Lots of good work in trying to make this happen and keep it going. So we're going to be carrying on in our entirely voluntary capacity, because this is something that we all believe in, and this is something that's important. And we hope that very much that you will all join us for the next chat, which will be along at some point soon. You will receive a notification. We're not committing to doing them fully on a monthly basis, because that's a huge amount of work, but we'll see what we can do. And we look forward to another conversation in the future. So really, thank you very much, Bharat and Mamune, for your really inspiring words and your wisdom. And that's all from me, unless anyone else has anything they want to say.
Tom, if you would allow us a maximum of 5 minutes, Irga want to present. It is similar thing. If anyone agrees, everyone agrees to listen how we have done the community engagement through the use of construction toolkit. That is a very small amount of support, but how the communities are working on it. There will be no presentation, but Irga wants to brief what he has done. Done for that.
No,
absolutely fine. Welcome to it. And of course, anyone who has to leave can vote with their feet.
No.
So,
Tom, I'm so sorry. Thank you, Bharat, for remembering and recalling me. But my intention was completely different, so I can't do it in 5 minutes. So I'm sorry. It's good to close this conversation in the way that was brilliantly concluded. So Another time,
Okay.
I can share my experience. No worries.
Well, would you
This
like
was
to
not
host?
my preparation.
Hmm.
I was preparing for the last 2-3 weeks, so I can't do it in 5 minutes. Sorry for that.
Okay. Perhaps this could be the subject of a future coffee and chat session then.
It could
Maybe
be
that's something we can
if
talk about.
the organizers agree.
I think this is something we should explore.
Yeah,
Absolutely.
so, but sorry for my whatever.
No worries. Thank you very much to everyone. And I really did enjoy that. Thank you.
Thanks, Tom. Thanks, everyone. I'm looking forward to it, Jirga.
Thank you. Thank you.
Thank you.